Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Huria Amir. I welcome all of you to today's lecture, which is regarding the analgesia system, which is there in the central nervous system. Now, there is presence of quite a variation in the feeling of pain person to person. The degree to which a person reacts to pain varies tremendously. And why it is so? It is because that there is different capability of the brain to suppress input of pain signals to the nervous system by activating a pain control system which is known as the analgesia system. You can see, look at this diagram. You can see that there is presence of lot of areas which are quite important for release of so many neurotransmitters to neutralize this feeling of pain. The analgesia system is composed of three major components. There is periaqueductal gray area, then there is periventricular areas of the mesencephalon and upper pons, which are surrounding the aqueduct of sylvius and the portions of third and fourth ventricles. These are actually the areas which are very much important regarding the pain suppressing in our body. So these areas, they are comprising the analgesia system. Now what happens is that the neurons from these areas, they send signals to the raphe magnus nucleus, a thin midline nucleus which is located in the lower pons and upper medulla, and the nucleus reticularis paragigantocellularis located laterally in the medulla. Now from these nuclei, the second order neurons, they are transmitted down the dorsolateral columns in the spinal cord to a pain inhibitory complex located in the dorsal horns of spinal cord. At this point, the analgesia signals, they can block the pain before it is relayed to the brain. Now, electrical stimulation either in the periaqueductal gray area or in the raphe magnus nucleus can suppress many strong pain signals entering by way of the dorsal spinal roots. Also, stimulation of areas at still higher levels of the brain that excite the periaqueductal gray area can also suppress the sensation of pain. Some of the areas, they are like the periventricular nuclei in the hypothalamus, which are lying adjacent to third ventricle, to a lesser extent the medial forebrain bundle, also in the hypothalamus. There is release of several substances which are involved in the analgesia system. And what are these substances? They are like enkephalins, serotonin. Now many nerve fibers derived from the periventricular nuclei and the periaqueductal gray area, they secrete enkephalin at their endings. The endings of these fibers in the raphe magnus nucleus, they release enkephalin when stimulated. Now fibers which are originating in this area, they send signals to the dorsal horns of the spinal cord to secrete serotonin at their endings. The serotonin causes local cord neurons to secrete enkephalin as well. The enkephalin is believed to cause both presynaptic and postsynaptic inhibition of incoming type C and type A delta pain fibers where they synapse in the dorsal horns. So you can see that the function of these substances like serotonin and enkephalin is actually the inhibition of the type of fibers which are actually bringing the pain sensations. Like for the slow pain fibers, you all know that the type C fibers, they're important. For fast pain fibers, you all know that A delta pain fibers. And they are going to do what? That they are going to do the presynaptic and postsynaptic inhibition over there where the synapses is taking place in the dorsal horns. Thus, the analgesia system can block the pain signals at the initial entry point to the to the spinal cord. In fact, it can also block many local cord reflexes which result from pain signals. Now, in addition to this, there is brain's opiate system, endorphins, and enkephalins. Now, more than 40 years ago, it was discovered that injection of minute quantities of morphine either into the periventricular nucleus around the third ventricle or into the periaqueductal gray area of the brainstem, they cause an extreme degree of analgesia. It has been found that morphine-like agents, mainly the opiates, also act at many other points in the analgesia system, including the dorsal horns of spinal cord. Because most drugs which alter the excitability of neurons do so by acting on synaptic receptors, it was assumed that morphine receptors of the analgesia system must be receptors for some morphine-like neurotransmitter which is naturally secreted over there in the brain. About a dozen such opiate-like substances have been found up till now at different points of the nervous system. And all of them, they are actually the breakdown products of three large protein molecules like pro-opiomelanocortin, pro-kephalin, pro-dynorphin. Among the more important of these opiate-like substances, there are beta-endorphins, met-enkephalins, leu-enkephalins, and dynorphin. So it is very important for all of you to learn the word enkephalin. Enkephalin including beta, met, leu, and then dynorphins. They are very important because all of these substances, they're going to act like opiates, morphine-like activity. The two enkephalins, which are found in the brainstem and spinal cord in the portions of the analgesia system, beta-endorphin is present in both hypothalamus and pituitary gland. Dynorphin is found mainly in the same areas as the enkephalins, but in much lower quantities. So, the thing whenever you are being asked about any sort of analgesia which is naturally occurring in our body, so the answer should be enkephalin. And if you want to elaborate it, you can use the words met, dew, leu. So, endorphins are working the same, but they are actually in the less amount. Now, what are the actions of endorphins? All endorphins, they act by attaching to opiate receptors on the plasma membrane of the efferent neuron. The result is actually the inhibition of releasing of neurotransmitter, thus blocking the transmission of the painful stimulus. Now comes the how the activation of the analgesia system occurs by nervous signal. Well, activation of analgesia system by nervous signal entering the periaqueductal, gray and periventricular areas or inactivation of pain pathways by morphine-like drugs can almost totally suppress many pain signals entering through the peripheral nerves. Morphine is an addicting drug in that it causes tolerance. What is tolerance? Tolerance is actually the need for an increasing dose to get the similar type of effect. Or in other words, you can say that the need for an increasing dose to cause a given analgesic or other effect, and dependence is defined as the compulsive need to keep taking the drug at almost any cost. So you are very much liked to know these two terms, tolerance and dependence. Now, acupuncture at a location distant from the site of a pain also acts by releasing endorphins. Acupuncture at the site of the pain appears to act primarily in the same way as touching. Now is inhibition of pain transmission by simultaneous tactile sensory signals. Another important event in the saga of pain control was the discovery that stimulation of large type of A-beta sensory fibers from the peripheral tactile receptors can depress transmission of pain signals from the same body area. This presumably results from local lateral inhibition in the spinal cord. It explains why such simple maneuvers as like rubbing the skin near the painful areas is quite often effective in relieving pain. This mechanism and the simultaneous psychogenic excitation of the central analgesia system are probably also the basis of pain relief by acupuncture. Then there is how we are going to treat it. Now, the treatment of pain also occurs by electrical stimulation. Several clinical procedures have been developed for suppressing pain by electrical stimulation. Stimulating electrodes, they are placed on the selected areas of the skin or on occasion implanted over the spinal cord, supposedly to stimulate the dorsal sensory columns. In some patients, electrodes have been placed in appropriate intralaminar nuclei of thalamus or in the periventricular or periaqueductal area of the diencephalon. The patient can then personally control the degree of stimulation. Dramatic relief has been reported in some instances. Also, pain relief has been reported to last for as long as for like 24 hours after only a few minutes of stimulation. Then, another method is the surgical interruption of pain pathways. When a person has severe and intractable pain, sometimes because of the spreading cancer, it is necessary to relieve the pain. To do this, the pain nervous pathways can be cut at any one of the several points. If the pain is in the lower part of the body, anterolateral cordotomy in the thoracic region of the spinal cord often relieves the pain for a few weeks to few months. To do this, the spinal cord on the side opposite to the pain is partially cut in its anterolateral quadrant to interrupt the anterolateral sensory pathway. A cordotomy, however, is not always successful in relieving pain for two reasons. First, many pain fibers from the upper part of the body do not cross to opposite side of the spinal cord until they have reached the brain, so that cordotomy does not transect these fibers. Second, the pain frequently returns several months later, partially as a result of sensitization of other pathways that normally are too weak to be effectual, for example, the sparse pathways over there in the dorsolateral cord. Another experimental operative procedure to relieve pain has been to cauterize, to do electrocution of the specific pain areas in the intralaminar nuclei in the thalamus, which often relieves suffering types of pain while relieving intact one's appreciation of acute pain, an important protective mechanism. So that's all about the analgesia system, the different methods of treatment, the new interventions regarding pain management. So this is all about today's lecture. Thank you very much all of you. Stay blessed. Allah Hafiz.